Today we're going to really talk about heart health. And when I was thinking about this presentation, I was thinking, man, this is a huge topic. We could talk for hours and hours and hours and hours on heart health. But I wanted to pick 3 to 4 very practical things that you as listeners can really take right away and start to implement in your lives. And as well, what I wanted to do is give you some research as well to be able to kind of start thinking about. So it's a meaty subject, but let's get started right away. So let's talk about statistics for our type A analytical people. Every 7 minutes in Canada, someone dies of heart attack or stroke. Okay? That's an absolutely astounding number. We talk about economics of heart disease just in Canada. We as taxpayers, just to treat heart disease, spend $21 billion every single year on heart disease and stroke. Okay? If that number doesn't, so that's 9 zeros past a 20. Okay, so that's an absolutely astounding number. We look about, if it's taxpayer dollars that's really kind of, that we're paying for heart disease, that's $700 a year that every single one of you is paying for heart disease. If you pay taxes 30, 40, 50 years, that's about $42,000 of investment that you've made into other people's heart attacks. Okay, so just on a level of statistics and economics, heart disease is a huge, huge, huge factor in terms of our economy. Okay? In Canada, 3 out of 4 people will be diagnosed with some form of heart disease, some form of symptom, whether it's high blood pressure, stroke, heart attack, you name it. 29% of Canadians will end up eventually dying from heart disease or stroke-related death. And that, to me, is the whole reason why I do this, because I want to reach out to as many people as I possibly can to educate you on just some very simple things that you might be doing today that you can change today. There's 2 types of heart disease. Everyone understands the cardiovascular type of heart disease. So this is either heart attack or stroke caused by some form of plaquing or clogging of arteries that's really going to create a blockage on how the blood flows to a tissue. Now that tissue could be your heart, and that's what a heart attack is, where the actual tissue of the heart dies. Everybody nod your head if you understand that. Yeah? And then there's the stroke, which is when we have a clog that goes up to the brain or a plaque that goes up to the brain, and that causes death of brain tissue. That's what a stroke is. And we all know the symptoms of a heart attack, right? We could have chest pain. Everybody understands that. We could have numbness down into the hands. We could have any jaw pain or anything like that. But a lot of times people don't even know they're having a heart attack until it's done. Okay? Symptoms of stroke are numbness in the face, headaches, visual change or dizziness, weakness or paralysis in some of the muscles. So these are what we're talking about in terms of cardiovascular disease or heart disease that's in a cardiovascular realm. There's also sudden cardiac arrest or cardiac death. This is an electrical issue. It means your heart just stops. So if you've ever heard of things like ventricular fibrillation or atrial fibrillation, this is an electrical type of heart disease, okay? The etiologies or the cause of that is totally different. Okay, so we're going to keep moving on here. I want you when we talk about heart disease, stroke, I want you to think in terms of event versus a process, okay? What we think of is imagine that you're sitting there, you feel great today, and tomorrow you have a heart attack. The question would be, I want you to ask yourself right now, was I sick the moment I had my heart attack, or was I sick for years before? Does that make sense? Because it's a process. Heart disease, cancer, diabetes, Alzheimer's, any kind of disease of lifestyle that we have, it's a process. Because it takes you years and years and years to build that kind of problem before it manifests as some type of physical symptom. Okay, so most of us, especially our medical system, we kind of treat this as an event. You had a heart attack, and now guess what? You're sick. Okay? Now you're sick. Now you're labeled with heart disease, and you go through the steps of a heart disease patient. Okay, what we have to think about is, remember, you cannot treat heart disease as an event. You have to treat it like a process. I'll be right out front. You can reverse heart disease. You can reverse any disease process that your body creates if you do the right things. And I want to at least give you some tips so that you can run out of here and start implementing. Okay? So what causes heart disease? And I'm talking about cardiovascular type of heart disease. Have you guys heard the word inflammation before? Raise your hands if you've heard of inflammation. Okay, inflammation, it's a natural healing process of the body. But the problem is that as North Americans, we are chronically inflamed all the time. So when inflammation happens, it's a bunch of cellular mediators and cellular markers that actually cause damage to artery walls or cause damage to tissues. Okay, and what happens, you can see in some of these things here, if anybody ever wants this PowerPoint, please email me and I can always get it for you. In a normal artery, it's very elastic, but what happens is when inflammation happens is that the cells become damaged. And your body has this automatic, beautiful, innate, we'll call it innate, built-in mechanism whereby it tries to heal that artery and it sends inflammatory markers. And what happens is your liver starts to trigger the production of cholesterol. Who has not heard of cholesterol? Because it's pretty quiet in here. So understand that cholesterol is your body's ability to heal these arteries, right? So cholesterol starts building up, and then we get a plaque formation in that artery because the whole purpose of the cholesterol is to heal it. And what happens with the inflammation, the cholesterol build up, then it starts to harden those arteries and they don't get that elasticity. And then once that happens, once the arteries harden, your heart's just pumping its blood, therefore it has to raise its blood pressure. So if we start having high cholesterol, we have high blood pressure, we have hardened arteries, that's what diagnosis in a medical model. Heart disease, right? So we have to talk about this because this is a key factor. And we're going to kind of focus in on a couple things. So let's just say you go to your medical doctor and now you're diagnosed with some form of heart disease. Okay? Or maybe you had a heart attack or a stroke and they've done and put you through some tests. They're going to look at two things. Your only two options on a medical model right now in Canada, in Kelowna, in British Columbia, are twofold. You can either have surgery or you have medications. Does anybody disagree with this? This is in a medical system, okay? So surgeries, things like pacemakers, stents are put in, bypass surgeries, all very, very risky. Do you guys disagree with that? No, this very, very risky. Understand that the next step is medications. We can cut your blood pressure with blood pressure medications. We can cut your cholesterol with cholesterol medications. We can thin your blood with blood thinners. And we can also try to lower your heart rate. All the symptoms of heart disease. So when we look at the medical model, they look at the heart disease as something that they approach from an outside-in perspective. Today, like I said, it's about stopping heart disease from the inside out. Okay, so this is what we want to talk about today. So we're focused on cholesterol, for instance. Cholesterol is a waxy substance that's produced by your liver. It is normal, and it is absolutely critical to your health. So the biggest fallacy is that cholesterol causes heart attacks and death. Who has not heard of that, right? So understand is that cholesterol, there's two types. There's the good cholesterol and the bad cholesterol. Bad cholesterol is LDL, or low density lipoprotein. And good cholesterol, from a medical perspective, is HDL, or high density lipoprotein. All produced by your liver 80% of the time. Cholesterol, when you look at what it's needed for wound healing. It's needed to produce testosterone for males. Important hormone or non-important hormone for males? Important, yeah, very important. What about estrogen? You need cholesterol to produce estrogen, progesterone. You need it for your nervous system, and in fact, your brain tissue is about 60% cholesterol. And every cell in your body has a cellular phospholipid bilayer that's made of cholesterol. So your cells need cholesterol. Your brain needs cholesterol. When you heal a wound or a cut, you need cholesterol to do that. Okay, so we have to talk about this because this is one of the biggest things is medical model. We think that cholesterol causes heart attacks. In fact, there's a couple of truths here. If you look at Dr. Joe Mercola's website, mercola.com, it's an abundance of research and it's absolutely amazing. But the truths, more people have heart attacks with normal cholesterol than with lower cholesterol. Okay? There's a higher death rate with people with lower cholesterol than with high cholesterol. Is anybody shocked yet? Yeah. Statin drugs, cholesterol-lowering drugs, these are things like Lipitor, Crestor, Malvacor, any off-label brand. The whole purpose is to lower your cholesterol. The mortality rate of heart attack and stroke does not go down when people take statin drugs. Okay, so I wanted to kind of focus a little bit on statin drugs. Remember, cholesterol is your body's repair substance. It's critical to your health. You want cholesterol, okay? And the other fallacy is that it comes from diet most of the time. Most people, when we do our studies and research, stress is a huge factor in producing low-density lipoprotein, okay? But that's for another time. We can talk about that later. So what do we have? Cholesterol medications. I said things like Crestor, Lipitor, Malvacor. They're very dangerous medications, and I'm talking pharmaceutical medications. Very, very dangerous. So this is a tip I want you to think. If you can think about taking something home today, looking at your statin medications if you're on them, or if you know a loved one that's on them, try giving them some information. At least send them to Dr. Mercola's website to look this up. It's really critical. So when you ask yourself that question, should I lower my cholesterol? Every symptom that your body produces, everything your body produces is for the right reason at the right time. If you learn anything today, it's to trust your body. From the inside out, trust your body. Even bad cholesterol is actually good cholesterol because LDL is needed for wound healing. It's, like I said, it's needed for production of hormones and testosterone and estrogen. And Dr. Ron Rosedale, a medical doctor, says this. He said, in other words, it has never been conclusively shown that lowering cholesterol saves lives. In fact, several large studies have shown that lowering cholesterol into the range currently recommended is correlated with increased risk of death, especially from cancer. Okay? So these are the kind of questions I really want my patients, I want the public, I want my community to ask is, have we been doing the right thing? So why are the death rates for heart disease going up and up and up? Right? It's because we're not getting to the core foundation of what causes heart disease in the first place. So if we know that inflammation is the major culprit behind cardiovascular disease, in fact, inflammation is the major culprit behind things like cancer and many other diseases that we suffer from in North America, we have to know what causes inflammation in the first place. So we're going to talk about sugar, we're going to talk about fatty acids. Okay, again, I know a little bit about this, but this might not be my primary source of expertise. Medications, we just talked about that, increases inflammation. And we're going to talk about acidity a little bit more. So these are some of your practical tips. So this is where you'd want to take notes, or as I call them, a writer-downer. Okay? Let's talk about sugar. Who loves sugar? Raise your hand. Even if you don't eat it, yeah. Sugar, oh man, sugar, oh, so nice. And it's very addictive too, so it makes you feel really warm inside. Grains, who likes whole wheat bread or white bread, or, you know, we all do it. It makes us feel good. In fact, what I've recently found out is that wheat triggers opiate receptors in your brain. So it makes you feel joyous and overwhelmed and just whole, you know, baked bread or whatever, right? So it actually triggers this sort of opiate receptor. So no wonder why people love it and are addicted to it. But let's talk about sugar, for instance. Sugar causes an increase in your blood pressure, or sorry, blood sugar. And when we increase our blood sugar, what's the automatic response by your pancreas? It produces insulin. Yeah, it produces insulin. So when grains, and here's the scary part about grains. We know sugar's bad for us. It causes an increase in insulin. That increased insulin causes inflammation. And it causes an activation of cortisol as well, which increases enzyme PLA2, which in turn increases inflammation, which is the 90% cause of most diseases. Inflammation causes damage to cell walls and arteries, therefore cholesterol's activated and plaques build up in your arteries. So this is how sugar actually causes heart disease, okay? Secondly, we talk about grains. Most people don't equate the bread that they're eating to table sugar. Raise your hand if you've understood this yet. So most of the wheat that every one of you is eating right now is genetically modified. It's been genetically modified to become hardy, so that when the farmers are growing it in Saskatchewan or Manitoba, that it can withstand drought, it can withstand flooding, it can withstand cold, bacteria, viruses, or whatever. And it's been so genetically modified that in fact it actually goes to your blood sugar faster than sugar. Isn't that crazy? So here's the other thing, is that most meat that you guys eat is grain-fed. So what's happening to our cattle now is that we're feeding these cattle all these grains and blood sugar. Their blood sugar goes up, their insulin levels go up as cattle, and as well as their insulin going up, so goes up inflammation. And inflammation actually causes their fat, or the animal fat, to become rancid. So you're basically eating diabetic cattle. Isn't that crazy? And that diabetic cattle, what's happening to that is it becomes a trans fat. And that trans fat causes acidity in you and causes inflammation in you. So that is where we start to see changes in our inflammatory components of our blood. And I'll kind of touch on that a little bit later as we get in. But we have to, right off the bat, you have to cut the amount of grains and sugars you're putting into your body if you're dealing with heart disease, or if you would like to prevent future heart disease from ever happening. So what do? We got to eat as organic as we possibly can. So this is your registered holistic nutritionist and your naturopaths who are going to show you how to do this properly. And what you're going to do is you're going to get to things that like ancient grains. The Bible talks about Ezekiel bread. Okay, organic Ezekiel bread. If you're a grain freak and you need to eat grains, Ezekiel bread is the grain you should go to at least. Okay, so that's tip number maybe 6 already, I don't know. Essential fatty acids. This is your omega-3s and your omega-6s. The proper ratio that you want from omega-3 to omega-6 is 2 to 1. So you want to have higher levels of omega-3s than you do omega-6. Omega-3 is a natural anti-inflammatory. So if it's a natural anti-inflammatory and you have less inflammation, it means you have less chances of things like heart disease and cancer and diabetes forming within the body. Research shows that omega-3 fatty acids that are found in things like fish oils, so that's salmon oils, cod liver oil, I think mackerel and cold water fishes, actually reduces the amount of plaque and heart disease within your body. Okay? Fish oil helps reduce inflammation. It cleans the arteries and it lowers that level of omega-6 to omega-3. Most North Americans have higher levels of omega-6s. We're like 50 to 1 omega-6 to omega-3. We want to be 2 to 1 omega-3 to omega-6. So start supplementing with fish oils, a good fish oil, a filtered fish oil. Okay? Talk to your naturopath, talk to your registered holistic nutritionist, go to Nature's Fair, ask some questions. Okay? Eating grass-fed beef. Now this is going to be really controversial. For males like me who love to eat beef, this is the best news that I've ever heard in my life. Eating grass-fed beef versus grain-fed beef will reduce your omega-6 to omega-3 ratio to almost 4 to 1 just by eating grass-fed beef. Do you remember how I said that grain-fed beef is super inflammatory and causes, basically the cattle's diabetic? So eating grass-fed beef is going to lower your risk of cardiovascular disease. And I know that's controversial because your doctors likely have said quit eating red meat, right? Quit eating red meat as much as you do. So understand that this is great news, right? So we can actually eat what we were intended to eat and still get healthy. So just a list of things like healthy fats. You want olive oils, you want coconut oils, grapeseed oils, okay? Nuts like almonds and cashews. And you want to look into saturated fat. Saturated fat is actually good for you if it's not a trans fat. Okay, so like grass-fed meats, grass-fed chickens, turkeys, beef, lamb, etc. Okay, you want to stay away from damaged fats like trans fats, which you find in things like potato chips. You find in grain-fed or corn-fed meats, whether it's turkey or chicken or anything like that. You want to stay away from canola oil and vegetable oil and oils that have gone rancid because it changes the components. Canola oil, a lot of times is touted as a health product. It was actually designed for cars. Stay away from commercialized meats as well. Let's talk about pH, or talk about acidity. We know that everyone's heard of you're too acidic or you want to go to more of an alkaline. Understand it's a 14-point scale. Below 7 is acidic and above 7 is alkaline. Alkaline is basic. It's a chemical talk, right? To be neutral, you want to be a 7.3. Okay? Anytime you're acidic, it causes inflammation within the body. And that causes plaquing, cholesterol buildup, and basically heart disease. Not to mention acidity is related to things like cancer and all other sort of major illnesses. Okay? And it creates inflammation. These are sources of acidity. Conventionally bought red meat chicken and fowl. Okay? We have sugar causes acidity. Pop causes acidity. Artificial sweeteners, tobacco, alcohol, caffeine, dairy, these all cause acidity. And not to mention every single medication on the market in the pharmaceutical industry causes acidity to build up in the body, which is a major factor in heart disease. So look into your cabinets, look at your food labels, read things about what you're actually putting in your body. Okay? That's the real tenet to true health. Okay, we're going to talk about exercise. Everyone's heard this, right? Exercise decreases heart disease. Exercise decreases cancer. Exercise decreases weight, blood pressure, blood sugar. And if you're the person that's never exercised in your life, all I want you to do is get out and go for a walk. Okay, do that 2 to 3 times a week. It will reduce your risk of cardiovascular disease and heart disease by 33% or more. If you want to get more in tune, what you want to do is look at high intensity, short duration exercises. And for more information, again, go ahead and email me about that, and I can teach you a little bit more. Or you can see a personal trainer, ask some questions. Get online and look up. Just get out and move, because we were designed to move. And that's absolutely, that's a critical step, okay? But this next part is really what I want to talk about, okay? This is my expertise. This is the connection between your brain and the rest of your body, okay? So chiropractic, what I do, doctor of chiropractic, my main goal is to make sure that your body is connected to your brain, that your cells are connected to your brain. Because your brain, your spinal cord, and the nerves, that's your central nervous system. Any book that you read, all the nerves basically from your neck, between the base of your neck and the upper thoracic spine supply the heart. Okay, so we have to make sure that the nerves are functioning well. And when we talk about chiropractic, everyone's just sort of, every time someone says, you're a chiropractor, they always tend to stand up a lot straighter. Right? And they say, well, posture is important. I have good posture. I don't mean the posture just by the way you're standing. I mean the inside posture of your spine. Do you guys know that the posture of your spine from the front should be straight up and down, and from the side should have 3 very distinct curvatures? So what you're visualizing here is an X-ray of the neck. Okay, the neck is a very important region. And if you want to know how important it is, just think back to when Christopher Reeves fell off that horse. And he hurt his spinal cord. Basically, he had a bone sticking into his spinal cord that was the size of the tip of your pinky finger. Every function in his body was cut off, because the spinal cord that exists right here, it coordinates all function of the body. From the brain, down through the brainstem, down the spinal cord. Now imagine you lose that curvature in your neck. What happens to the spinal cord? So basically that neck curve, we lose that curve. It causes a choking of the spinal cord from the inside out. Okay, I want to show you this picture here. This next one. So you're going to see this X-ray. This is facing the opposite way. This is a patient of mine. What you'll see on this X-ray, at the very base, you should see a really nice curvature in that neck. We're losing that. This patient is losing that curvature. He's a 57-year-old male. He lost the majority of that curvature, but if you look at the base of the spine, you'll see degenerative disc disease. Everyone's heard of that? Another synonym for that is osteoarthritis. But basically the discs degenerate. Now this patient was in a car accident 15 years ago, and he sought out all forms of therapy because he had whiplash and frozen shoulder. He sought everything out, like acupuncture, medications, physio, heat baths, cold baths, massage. Nothing helped him. He went to a chiropractor. He went for 3 weeks, and his arthritis, or his whiplash was gone. And he was so excited about that. But what happened is he continued on. After that, most North Americans, when their pain is gone and they feel good, equate that with health. And this is exactly what happened with this patient. And in 2007, this patient had a sudden cardiac arrest. His heart stopped at dinner. And his wife and his wife's friend had to perform CPR on him to save his life. This is my dad. So on October 27th, 2007, I got the phone call when I was in Toronto. Your dad's in a coma. He was defibrillated 6 times to start his heart. What you have to know is that those nerves right there, they're the ones that supply the heart. Okay, this is absolutely, and I know this is bringing tears to some people, but for me, this is why I have to do this, is because people don't understand the connection between the brain and the rest of the body. Okay? And when you look at what an X-ray like this would look like on the inside, this is the brain stem and the spinal cord down here. And when there's osteoarthritis, it starts to choke the spinal cord. It starts to degenerate the tissue of your spinal cord. I cannot teach this enough. I cannot speak about this enough, because this is your lifeline. And for my dad, he's alive. So I am one of the luckiest guys in the world, and my mom's the luckiest person in the world. And so is my dad. But we have to help him correct this problem. And that's what chiropractic does. That's what a qualified chiropractor does, is to correct the spinal column, to correct the alignment so that it takes pressure off the nerve. So why would that happen? Just like your car is out of alignment. One tire wears out faster than the other ones. Same thing happens with your joints. Okay, so I have to teach this as much as I possibly can. This is why you'll see me everywhere. So this is caused by subluxation. That's a misalignment of a spinal joint that chokes the nerves and chokes the spinal cord. And it's absolutely critical to understand this, because you will not feel subluxation 90% of the time, because your spinal cord and brain only have 10% tissue devoted to sensation or feeling of pain. So my dad went away feeling great, therefore he's healthy. And it just so happened he had a heart attack. And when he goes to the medical system, he goes through a gamut of tests. He goes through blood tests, EKGs, echocardiograms, x-rays, MRIs. The only thing they know is that he's got an electrical wave issue, a P wave issue. And it looks like Brugada's syndrome or some genetic mutation. So therefore they recommend all his sons get pacemakers put in preventatively. I just said, we have to identify the source. So when I said medicine's an outside-in approach, we have to look from the core, the foundation first. This is what chiropractic's all about. Research on chiropractic. Specific chiropractic adjustments to the upper cervical spine cut systolic blood pressure, that's the upper number, and diastolic blood pressure by 14 points and 8 points respectively. And it holds it for 8 weeks. That's stronger than 2 high blood pressure medications combined together. This was done in the University of Chicago and published in the Journal of Hypertension. Chiropractic research not even done by chiropractors. In 1921, Dr. Henry Windsor, he heard about this word subluxation. He heard about these chiropractors. He heard about these doctors getting these amazing results. And he said, I'm going to disprove this. Or you know what, I'm going to prove it if I can. I'm going to do whatever I can. Whatever I find is going to be the news. And he did this, and he looked at cadavers that had died of organ-based diseases, and 75 out of 75 people, he did studies on cats and dogs as well. We'll talk about people for today. He did cases, 75 of them, who died of visceral disease based on organs, heart disease, lung disease, pancreas disease, kidney disease, and spleen disease. Every single one of them had a diseased organ when he opened them up, attached to a shriveled up nerve, attached to a misaligned spinal segment that was arthritic, that was worn out. In 1921, Dr. Henry Windsor proved the theory of subluxation. He proved that visceral disease is caused 100% of the time by misaligned spinal segments. So when your chiropractor's talking to you about getting adjusted, this is why we do it, okay? Since 1920, for 100 years, medicine hasn't caught up on this yet at all. They've been putting it under the rug and doing clinical trials over and over again, okay? So when I talk about this, I do it with passion. I may be spitting on people. I don't know how passionate I am, but this is what I do. And what we do, we had over 115 years of scientific research proving that a chiropractic adjustment takes pressure off of the nerve and off of the spinal cord to allow your body to heal itself from the inside out. So even Uncle John, who eats white bread and bacon sandwiches and drinks whiskey his whole life, lives to 99, and Lance Armstrong gets cancer in his 30s, it means the bodies are functioning at a different level. If you are sick, your body's not functioning right. My goal as a chiropractor, all my colleagues' goals, is to help your bodies function at their optimum. That's it. And let the body do the rest. And to do your best to not poison your body with toxins and foods and whatever would poison your body. Does that make sense? And this is the principle of health. Just remember the one thing now in closing, that your body has innate intelligence built within it to heal itself, okay? You just have to stop interfering with innate intelligence. Let your body do what it's supposed to do. Chiropractic helps your body promote innate intelligence to help your cells heal from the inside out. And then when you add all the good foods in, you can actually absorb them. When you take in those fish oils, you can absolutely absorb them. So I'm done speaking, and you know what, it's been a pleasure to do this, and I hope you learned something. I hope in this short time that we had, you could take something away and implement right now. Thank you.